Mrdjenovich, Doctor of Podiatric Medicine and Certified Wound Specialist. I initially met one of the reps at a conference, and we reached out to each other, and through his email, I was able to register for the virtual training. The scheduling of the virtual training was very easy, and it was able to be scheduled at our convenience. The virtual training was very interactive. We were all able to pause the trainer and to ask questions as we went along. Everything was answered to our satisfaction. It was very clear, very simple. The learning curve for the ActiGraft procedure is very minimal. It's very simple. After you watch it once, you basically know how to do it. Since using ActiGraft on two of my patients, they have responded excellently. I'm very satisfied with the response that they have had. My patients reacted to the ActiGraft procedure. They were very enthusiastic because it was something new, something that hasn't been tried in the area. So they were kind of excited that they were on the front end of the procedure. And they also liked the results. I saw differences within the first few applications. I saw increased granulation tissue, increased epithelial migration, and just overall decreased inflammation of the area. So why did I choose ActiGraft as a treatment option? I thought it was interesting concept. I also thought it made sense. Use the patient's own blood. You can do it right then and there. You didn't have to wait. Didn't have to send it out. ActiGraft is very unique from anything I've used. Using the patient's own blood, waiting that 11 to 12 minutes. It gives you a little bit of time to really talk to your patients too, which is kind of neat. But I just like, and I think the patient likes that they could see it's coming from their arm, being made right in front of them, and it's being put in their wound. I think there's a connection there. It feels really great to see patients heal using ActiGraft. It makes the patient feel better. It makes the patients feel very good to see that things are actually progressing. And from a provider's point of view, it really feels good to be able to give that to your patient to say, okay, we got you to the next step of healing. So between the virtual training and with the results I've seen with ActiGraft, I would definitely recommend that other providers, wound care providers, try this technology and this treatment. I think that they'll find that it's very simple and it makes sense. Once you get your hands wet and use it a few times, you're going to see that it's not hard at all. So, and I think you'll like what you see.